On Rare is a podcast developed by BridgeBio to educate ourselves and the public about living with a rare disease. Since our guests aren't scripted and are free to speak their minds, their views and opinions don't necessarily reflect the views and policy of BridgeBio Pharma. Now, we hope you enjoy the podcast.
Welcome to On Rare, a rare disease podcast produced by BridgeBio, a biotech company that focuses on developing treatments for rare diseases. At On Rare, we explore what it's like to live with a rare disease, from getting a diagnosis to the challenges of daily life. On Rare gives us a really unique opportunity to listen and learn from the true experts, people living with rare conditions. I'm your host, Mandy Rohrig, a member of the patient advocacy team, and I'm joined by my colleague, David Rintel, head of patient advocacy. Today we're talking with Jessica, who's living with a rare condition called autosomal dominant hypocalcemia type 1, or better known as ADH1.
I really don't know that much about ADH1, Mandy, and I'm looking forward to speaking to Jessica and learning what it's like to live with ADH1. In order to learn more, let's first talk to my colleague, Dr. Mary Scott Roberts, an expert on ADH1. She is a pediatric endocrinologist, and she's also the executive director of clinical development at Calcilytics, the BridgeBio company that is working on ADH1. So, Mary Scott, welcome.
Thank you for having me.
ADH1 is a complicated condition, and could you please explain it to us?
Yes, I'll try my best. And I think before we get into the details of autosomal dominant hypocalcemia type 1 or ADH1, it would be helpful to first understand the role of calcium in all of our bodies. There are a number of different substances that are important for our body to function normally as it does every day. And one of those is calcium. And this is incredibly important that we have enough calcium in our bodies, of course, to make our bones strong, our teeth strong, but also to help our muscles work normally, our nerves to function, our heart to beat in a normal pattern. And we don't want calcium that's too high or calcium that's too low. And so one of the ways that our body tries to regulate calcium, and we have a protein, it's called the calcium sensing receptor. It's constantly detecting and measuring the calcium in our body and making sure that it's in the nice normal range. The parathyroid glands are small glands located in our neck, and they make a hormone called parathyroid hormone that works to increase blood calcium levels. So when our calcium levels drop, the calcium sensing receptor signals to the parathyroid gland and tells the gland to make more hormone so that we can bring our calcium levels back up. At the same time, this calcium sensing receptor tells our kidneys to hold on to as much calcium as possible and not to lose it in the urine. And so taken together, this signaling keeps our blood calcium in a nice normal range.
So when everything is functioning correctly, our bodies measure the amount of calcium in the blood. And if there is not enough calcium in the blood, the parathyroid is instructed to produce more parathyroid hormone to retain more calcium. And it also signals the kidney to retain calcium because we need more of it. Is that correct?
That's exactly right. Thank you for the summary.
It's kind of like if the gas gauge on your car doesn't work, so you're running out of gas, and instead of signaling the driver to stop at a gas station, it tells the driver to just keep going, and it results in you running out of gas.
I think that's a really nice analogy.
And what happens then to someone who's run out of gas, or in this case, has a very low calcium level?
Well, if you have a low blood calcium level, you often have muscle cramps and muscle spasms, which, as you can imagine, can be quite painful. Mm-hmm. Sometimes they can involve most of the muscles in the body. This is something called tetany. Other patients experience symptoms related to the nerve function. So they have numbness that often occurs around their mouth. They have a burning or a prickling sensation, usually in the hands and the feet. This is called paresthesias. And even seizures can occur because of low blood calcium levels. And I think another thing that really impacts the life and the function of these patients with ADH1 is something called brain fog or difficulty concentrating or thinking clearly, as well as increased fatigue.
This sounds like it can be very challenging to people living with ADH1 and could be very serious.
You're exactly right. And I think another important thing to mention is that the extra calcium can cause buildup of calcium in the kidneys themselves. And this can lead to kidney stones, which are also very painful. And it can also cause damage to the kidney's ability to function normally.
So the consequences of low calcium are A, very uncomfortable, and B, very serious, can be very serious. And of course, seizures, very serious, and brain fog or, inability to concentrate is also really limiting. It's a story about calcium.
Right.
I wonder if you could tell us how it's usually diagnosed.
It really depends on the patient, David. There are some patients who present early in life with seizures and are diagnosed with low calcium, low parathyroid hormone. And then at that time, they may be diagnosed with ADH1 if genetic testing is performed. Other times, patients carry the diagnosis of hypoparathyroidism and they're not certain what the underlying cause is until later in life. I can think of other examples where adult patients might be diagnosed after their child receives the diagnosis of ADH1. And then they, in fact, also have ADH1 and didn't realize the tingling and the muscle cramps that they had experienced.
Thank you for that background. I think we are now much more prepared to hear from Jessica, a person living with ADH1, and understand what's causing the symptoms that she's going to be describing to us and the changes in her life. So thank you very much, Mary Scott. This has been enormously helpful. And now I'd like to introduce Jessica, a young woman living with autosomal dominant hypocalcemia type 1. How are you, Jessica?
I am doing well. How are you, David?
Good, thank you. And thank you so much for joining us on the podcast. Why don't we start with you telling us a little bit about yourself, just about your life. You're a person, you're not just a patient with ADH1, and I think that's really important to know more about you.
Absolutely. So I'm currently on the East Coast in Pennsylvania. That's where I reside. I work in the mental health field. I worked for the county as well as a big region insurance company, ensuring that mental health and physical health needs are met for my clients. I'm currently also 30 weeks pregnant. So that's also a big thing, having ADH1 and navigating pregnancy.
Congratulations. That's wonderful news.
Yeah, thank you.
And we'd be interested in hearing about pregnancy and ADH1.
Oh, absolutely. It's been a whirlwind.
Wow. And thank you for your very important work in mental health. Also,
Absolutely.
that these days, even more than ever, we recognize the importance of mental health care. So where does the ADH1 story begin for you? What were the first signs that there was something going on?
Right. So this is probably the truest origin story I feel like anyone could have. I was diagnosed with ADH1, actually just hypopara at that time, when I was about 8 minutes old at birth. The doctors noticed that my calcium was extremely low. I was about a month early anyway, and I was actually very healthy. I was almost 10 pounds. I was a very healthy baby, so that was awesome being early. But they noticed my calcium was low, and a pediatrician was on call at the time, and she tested my calcium and my PTH, and she saw how low the hormone was. So she automatically knew what I had. So that's really where it started for me, at least with the calcium PTH journey.
In the very beginning, and you were diagnosed, you said hypopara. So is that?
Hypoparathyroidism. Yeah, that's when I was diagnosed, because they didn't do no genetic testing at that time, due to them not really knowing why I had it, because there's no family history of hypoparathyroidism in my whole family, both sides. So it was kind of puzzling. A few years after that, I did get tested for any type of gene mutation. And that is where they really located the ADH1 with the CaSR gene mutation, the calcium receptor gene.
So that is really the origin story from the very beginning is, and very astute of the pediatrician to catch that. So what do you know about your infancy and what kind of care you needed or how it affected you at that time?
So thankfully, my mom kept every single file paperwork. I mean, she has a whole filing cabinet of every medicine I've ever been on, doctor, things like that. So I know I was started on World Caltrol pretty much right off the bat to maintain the calcium. That was working pretty well up until I want to say it was like I was 2 or 3. And that's when my mom started noticing me going into tetany, which is when the calcium drops and my muscles lock up. And what was funny is she had my doctor on speed dial, thankfully, and she beeped my doctor. I mean, it was the 90s, right? She beeped him. And the doctor was so excited because I was finally showing signs that I was low versus high, which is huge because now she was able to really adjust me accordingly. You know, I was on World Caltrol and calcium supplements like calcium chews. I remember vividly in pre-K having to take these calcium chocolate chews, and I would run from my mom because they were horrendous. I was doing okay. However, around like pre-K age, I passed my first kidney stone,
Wow.
which is when I was then diagnosed with the nephrocalcinosis due to the calcium sensor also being damaged on my kidneys. So that's when it started becoming more of a hassle for the doctors, because to maintain a good calcium level for me, but also avoiding damaging my kidneys any further, because during the ultrasound when I was diagnosed, the urologist was like, there's nothing that we can do for her moving forward. It's calcifying, you know, she's not eligible for a transplant because her body, you know, it's not worth it. So I know from talking to my mom, you know, hearing that, you know, her 5-year-old, her 4-year-old is pretty much dying. You know, that's what the doctor was pretty much saying. There's no hope for her kidneys. There's nothing we can do. She started working with my pediatric endocrinologist to look at other options. And at that time, there was some stuff going on actually over in Iceland, which has a pretty big ADH1 population. And she pretty much almost had me in a protocol over there. She was getting ready to relocate myself and her, and my dad was going to stay back in the States and work and send money. And then we got a call from the National Institute of Health, and they approved me to be one of the first children to start on the HPTH, which is a synthetic variation of the PTH hormone via injection. And that's really when I started to noticing my overall quality of life improve dramatically.
Wow. So Jessica, you this started early and you started to have complications also as a very young child. And just because most of us are pretty unfamiliar with ADH1, I just want to go back and first ask you, you said you had techne, and which was your muscles locking up. Can you just explain what you recall about that?
Absolutely. So what happens is when our calcium drops, our muscles in like our extremities, our face, and even like our throat can close up. It's like lockjaw times 10. I remember like there's videos of me in tetany and I'm like army crawling because I can't even stand because my feet are turned inward. My hands are pretty much looking like claws, and it is very painful. It feels like Charlie horses. And as a young child, you know, that was always the big fear, was going into tetany. And, you know, my mom was always so concerned, especially with me being at school, you know, having the teachers aware if you start seeing signs of the tetany or the tingling in the hands, which precurses the muscle spasms, to have milk on by or a Tums or things like that.
And you would take a Tums because of the calcium in it.
Because it would automatically boost me up really quickly. But give or take, because the Tums is very hard on kidneys for the calcium. So it was kind of got to outweigh a little bit. It's a balancing act, literally.
Yeah. Kind of a tightrope walk to get the right levels. Did that occur very frequently, the tetany?
It did. I vividly remember it occurring pretty often throughout my childhood. Which, I mean, if you think about it, growing constantly, height changes, weight changes, all these different changes occurring, your levels are going to be adjusting constantly.
And a kidney stone has got to be very painful. And I wonder if you recall when you had that. And
yeah, I remember feeling just like doubling over in pain. My mom honestly thought maybe it might have been like appendicitis or something like that, because typically you don't think kidney stone. And what was funny is we were actually doing a 24-hour urine collection at that time anyway for just like a monthly check. And that's when I actually passed it. So she was hearing the stone drop into the hat.
Wow. Wow. Incredible. I have to say, you were a child and, living your life, and that must have been a very difficult period for your mother. And in particular, when she was told there's no hope for Jessica, and then witnessing some of these symptoms must be just truly frightening for a parent. So
It definitely was tough.
And I'm guessing also for a young child.
It was tough.
So.
And I remember too, like, because she had to stop working because she was so afraid of, because with low calcium, it could go to tetany, but then it could go to seizures. It could go to other severe side effects. And so she quit her job just to be with me at all times.
And, I'm thinking that you're about to become a parent. And, when we become parents, our view of parenting and our parents really changes. So
absolutely.
Yeah,
absolutely. And if there's one thing I learned from my mom through navigating, this illness is advocate. Do not be afraid to raise your voice no matter what when it comes to your child, because you ultimately know your child best until they know their body best.
And your mom was ready to pick up and move to another country.
Yep.
To get you into a trial, and really was out there looking for solutions. It's very impressive.
Yeah. And I mean, with the protocol at the NIH, I mean, it was every 3 months for almost 2 weeks at times. Wow. That we'd be staying at the NIH all the way up in Bethesda. And literally, she lived her life for me. That's probably why I feel like I have such a good quality of life now, is because I had that support from her.
Yeah. That's very moving, and I hope that you thank her on our behalf, as I'm sure you thank her on your own, but that's really good to hear.
Absolutely.
All right, so you went on this, I guess, experimental treatment at NIH. That's why you're at NIH. And so what was life like once you started that?
It was a game changer. It's interesting because I remember, like, before I started the injections of the HPTH, that was my normal, not feeling 100%. Like, I didn't know any better, right? And once I started the injections and once they figured out my levels, it took some trial error. I just felt like I was able to be a normal kid again, besides having to take shots 3 to 4 times a day. But, I personally thought it was so cool that I was part of a research protocol. And that was always my show and tell for elementary school, was showing what I was doing, because I thought I was just this big shot. I just thought it was cool that I would give myself injections and I would feel better, and seeing the kidneys improve as well too throughout the whole trial, was just amazing.
That is wonderful to hear. So then you sort of lived your later childhood on that experimental treatment, and did you kind of remain stable? And
I did, yeah. So I started the protocol at 6, and around the time of high school, so like 9th grade, they started me on a pump, like an insulin pump with the HPTH. So it was constantly in my system. And that pump was when I really saw the drastic improvement. My kidney levels went normal. I had, like, even with the injections, I would still have some crashes, kind of like almost like an insulin crash when, you're managing diabetes. But when I had that pump and that constant, medicine in me throughout the hour, it was just tremendous. And sadly, of course, with protocols, it ended around the time I was 15. So I was no longer able to get the HPTH due to it not being approved yet by the FDA.
So during this time, the time that you're in the trial and you went through puberty, and of course there are all kinds of hormonal changes and other changes, and I wondered if the ADH1 or your treatment, if there are any issues about that.
Yeah, no, absolutely. I know my team, they were very worried about what puberty was, because as we know with ADH1 and even just the hypoparathyroid community, the menstrual cycle can be disrupted. Fertility is an issue. So they were definitely worried, but thankfully that whole side of things, the puberty, all that stuff, it was very normal for me. I was on point. I've had no issues. So I know I'm very lucky that it wasn't even disrupted or touched by the ADH1.
That's really, really good to hear. And you're able to finish school, go to college or university, go on for a graduate study. What else can you tell us about that time of life, becoming an adult, and also, I'm guessing, managing your ADH1 on your own instead of your fierce warrior mother managing your condition?
I know during high school, it was definitely That's when I think I started noticing that, wait a second, I definitely do have a condition, because up until that point, my mom raised me to be like, you are normal, quote unquote. There is no normal. We know that. But she made sure I had every opportunity, all that stuff. But as I got older, I was like, oh, wait a second. I need a nap on a Thursday, because getting up early 3 days or 4 days a week, I'm like fatigued. So that's when I really had to start listening to my body and knowing that as much as I want to do these sports, like, 'cause I loved swimming, I loved it, but there was so much running involved in high school, I couldn't keep up. I was having crashes even on a pump. So that was kind of hard to kind of navigate and kind of come to terms with that.
Mhm.
But I remember having, support from friends too in high school. And, my mom always made sure, and I made sure too, to educate my friends. And they always had Tums in their car when we would go off places, and,
Mhm.
just be honest. And the way I would explain it to you in high school, especially, was it's like diabetes, but with calcium.
Mhm.
If I'm low, I'm going to be, I might be in tetany, but I'm going to also be kind of cranky,
Yeah.
and I'm going to be kind of spacey, and kind of, I'm going to be off. So maybe
Mm.
offer me a
Mm.
glass of milk or things like that to kind of see if that's what's going on. And, college, I mean, it was, I felt like I had a better handle of things. I didn't live on campus in college. I lived off
Mhm.
campus with my parents. And I drove to and from to just kind of avoid, the financial hassle of all that.
Mm.
Just having more like freedom and things like that, I was really able to kind of figure out what worked with me with my condition and managing it, like scheduling medicine, having to adjust like when I would be changing my pump or when I would give an injection based on classes.
Yeah.
That was really important to me. And, I made sure even during college, typically that's when
Yeah.
young ones go off and experiment and have, fun and party. I made sure to stay clear of that, because I wanted to make sure to keep myself as healthy as possible, because I didn't know how I would react to it.
And you would learn the lessons about, as you were saying, waking up 3 days in a row, then you're really tired
Yep.
after that, and you needed to make adjustments or adaptations. There have been some limitations caused by ADH1.
Absolutely. Yeah. I mean, it's definitely hard. And I think the big thing too, like a big limitation, is just it being an invisible illness.
Mhm.
We don't we don't wear it,
Yeah.
and it's hard because, most days, even now, like before the pregnancy, like I was good, I was okay, no issues. But recently, a big symptom of this disorder has been kidney stones and kidney situations.
Mm.
So when that happens, or even if I have like low calcium symptoms, some of my like friends are kind of like,
Mhm.
oh, wait, we forgot you're sick.
Mm.
So even just, navigating that and try not to let it, stop me, because I'm pretty stubborn. And I mean, I've had this since birth, so I literally know no different.
Yeah.
So yeah.
So kind of a continuation of how you so well described explaining to your friends as a teenager what happens when your calcium level drops. And you said that you were cranky, that you weren't feeling well, you needed to take Tums, and they kind of learned that. And again, as an adult, it sounds like you needed to explain that again.
I almost have to explain it a bit more now, because I think, people see me, having graduated grad school, working a full-time job, married, all those things. They don't see me as Jessica with ADH1, they just see me as Jess. So when those ADH1 symptoms happen, or I have these doctor's appointments, or I'm fighting with insurance, but I have an amazing support system nonetheless, especially my husband now. I mean,
Mhm.
he's phenomenal with knowing my symptoms, like knowing, even just looking at me, he knows when I'm not feeling well, and he'll tell me, go take a nap. Just go lay down,
Mhm.
call your doctor, text your endocrinologist, let her know what's going on.
Really? So, if you don't mind sharing this, as you became serious with the man who's now your husband, I'm going to guess that he didn't perceive that you had ADH1 or a chronic condition,
Right.
that you needed to explain it to him. And I'm wondering how you did explain it to him and how he reacted.
I feel like this is just me with having this condition for my whole life. It's like my conversation starter. I don't know why. It always is like my go-to. As much as it's a headache, I'm proud of it. Like, it's made me stronger. It's made me who I am. And me being in the protocols has helped future generations.
Mhm.
So I always kind of start with that. And he actually is type 1 diabetic. So he had a pump.
Oh.
So that was kind of my segue, because I also had a pump,
Mhm.
except for mine was pink.
Mhm.
So we kind of started talking about that. And then he started asking more about my condition. And he started asking like, well, what does that mean with the calcium? Do you test it at home? Things like that. He started becoming more intrigued by it.
I'm guessing that you are each looking after each other now because diabetes also requires a lot of management and occasional adjustments of medication or watching blood sugar levels and needing a glass of orange juice once in a while if blood sugar drops precipitously. And so it sounds like you found each other as people who can really understand what it's like to live really well, but with a condition that can have a big impact on you if your levels are off.
Yep, absolutely. And like, that's why I think too, we work well together because we both understand that we have more good days than bad days, but we have that support system when we have those bad days because we get it.
Yeah. Now, you mentioned community before, and I know your mom was a really big support, and your husband is also now. And I wonder, have you engaged with the community of people living with ADH1 and related conditions? And
Yeah, I actually have. So while in the protocol for the NIH, I became pen pals with a few of those that actually live in Iceland, as well as another girl that grew up a few miles down the road from me that also had it, diagnosed a year before me. Same pediatric endocrinologist, everything. So we kind of bonded over that. And, we keep in touch now, even now through Facebook. And I am on the Hypoparathyroid Association. They do amazing things for just awareness for all the different types, all the variations. So, just, constantly seeing everyone's story and seeing how you can have the label of the ADH1 or even just hypopara and just how it's so different for everybody.
Yeah. It sounds like it's been useful to you, and I'm going to guess that you've been useful to other people as well through the organization and through your contacts around the world and around the neighborhood.
Yes, it's so funny, such a wide variety.
Yeah. This is a time to think about the future. You're an expectant mom, so there's a lot of future thinking. And what are your thoughts about the future living with ADH1?
I am incredibly hopeful. Just having ADH1 has made me have so much hope. Through everything, all the ups, the downs, it's just hoping for the next thing. And, with just new breakthroughs happening, more awareness of the ADH1, the genetic testing happening more frequently earlier on is just so remarkable. I'm just so hopeful to be able to see some big changes in treatment, and be able to engage in those options, as well as if my son does have it and the testing's already been set up and we're ready to go once he's born, I feel much better knowing that in even probably, relatively soon for him, if he does have it, there's going to be much more options. And even for me, and I had, better options than previously diagnosed people.
Yeah. Yeah. And you and your husband are involved in a pregnancy where you both have conditions that may have some genetic links. ADH1 certainly does. And that'll be an adventure of sorts to see how things happen. But it also sounds like you're both really prepared for whatever nature brings.
Absolutely. Yep, exactly. Because, we can't fight it. It is what it is.
Yeah.
And, just remain to have that hope and that faith that, it all work out. And I look at my story, what I've been through, according to that urologist when I was 6, I should not be here. So here I am. Everything's going good.
Yeah, that's wonderful to hear. And I was just thinking about that physician who said there's no hope to your mother, which is, of course, the absolute worst thing, or one of the worst things to say to a mother of a child. But look at you now. You're definitely here. You're about to have a child. You have a career. You're married. You're living a full and complete and productive life. Your story is one where you've really overcome the challenges of ADH1, or you are overcoming them every day.
I always say ADH1 doesn't have me. I have ADH1.
Yes, you haven't let it stop you, and that's really impressive.
Absolutely.
Thank you so much for sharing your story. This has really been enormously helpful and educational for me and others listening. Is there anything else you would like to add or anything we didn't get to?
I guess, it's just for anybody that has, any sort of invisible chronic illness that is rare, that is overlooked, try to look for the little victories, the little wins every day, because they're there. They're just hard to see. Because I really think if it wasn't for the hope that I had, I would not be here. Not only my hope, the hope of everybody around me.
I love that. Try to look for the little victories. That is a great mantra for anyone living with a long-term illness condition could benefit from. Living life well with a chronic condition is probably best done through a series of small victories. So thank you. That's very helpful.
Absolutely. Thank you so much for this opportunity.
I really enjoyed listening to Jessica's story. She has such an interesting and inspiring and really hopeful message. She's overcome a lot and has this positive outlook despite the challenges that she's faced.
Mandy, I so agree with you. I just want to point out, Jessica talks about participating in a clinical trial and taking various medicines. And it's important to say that those have nothing to do with BridgeBio or any research programs or clinical trials of BridgeBio. They are part of Jessica's story about living with ADH1, part of her journey. And people living with rare diseases, of course, seek out treatment and seek to participate in clinical trials. But what she's described is very separate from BridgeBio.
Thanks, David. And I think her participation in clinical trials throughout her life has guided her and given her that confidence to be an advocate for herself and inspire others to be an advocate for themselves. I think she summed it up really well with the phrase, advocate, advocate, advocate. Regardless of your situation and your circumstances, know yourself, trust your body, trust what you're feeling, and have that willingness to speak up and choose a different path if the one that you're on isn't working.
Well, really, the challenge of living with this condition, she was thankfully diagnosed very young, but had a lot of problems as a child. And when she described the technique, the terrible cramping she experienced, and really a difficult condition to live with. But I have to say, and I don't know if this is because I'm a parent, but I was really moved by what Jessica told us about her mother, that her mother was really willing to drop anything and go anywhere in an attempt to seek anything that would help Jessica. She was willing to go to another country, move to another city, and I hope that I would do that as a parent. I think I know, Mandy, that you've done that as a parent. It just demonstrates that parents of children living with rare diseases do everything possible to help their children. And I found that really moving.
And I have no doubt in my mind, David, that Jessica, as she becomes a mother, will be more than willing to provide whatever resources and support her child needs.
It was really a pleasure speaking to Jessica, to speak to Dr. Mary Scott Roberts, and of course, it's always a pleasure speaking with you, Mandy.
Thank you, David. And thank you again to our guests, and a very special thanks to our producer, Amy Brooks. To learn more about ADH1, check out the Hypoparathyroid Association at hypopara.org. If you like this podcast, please subscribe. Thanks so much for being with us today. I hope you'll join us for our next conversation on Rare.